Well, many of you continue to reach out with questions about the coronavirus and the booster shot. So I spoke with Dr. Mallika Marshall to get some of them answered. And we begin with Karen, who asks, I just got the new booster 2 days ago, and my husband tested positive for COVID today. How much protection do I have after only 2 days? That's a good question.
Unfortunately, probably not much. I mean, it usually takes about 2 to 3 weeks to actually build immunity after you get a booster shot. So I would consider him a close contact, and I would continue to take precautions, wearing masks around one another for at least 10 days from the onset of his symptoms. And you should probably test 5 days after your last exposure to your husband, or sooner if you develop symptoms.
Wow. Our second question comes from Michelle, who writes, I am a cancer patient in active treatment and up to date with my COVID boosters. My oldest son got COVID a few weeks ago. Does he need to test and mask up around me? And does my husband and other son, who are on a trip right now, need to wear a mask and test before coming back? Cancer patients do have very special conditions.
I know, and I feel so bad that people really have to consider all of these different details, but I understand your concerns, and I think you're doing the right thing to be really cautious. I would say your older son, if he recently had COVID, unlikely to have COVID again, so he probably doesn't pose a risk since he was infected just a few weeks ago. But your husband and your other son, if they haven't recently had COVID and they were traveling, then they probably should be pretty cautious around you. So that probably means masking around you and then testing right before they see you, and then again in 3 to 5 days, just to make sure that they weren't exposed while they were on their trip. Obviously, you can talk to your oncologist about this to get even more advice, but I think you're doing the right thing to be really cautious and make sure both you and your family members have received the most recent bivalent booster shot.
Right. That is going to be the important thing in the next few weeks, right? Heidi says, I have had shingles in my eyes since May. Is it okay for me to get a COVID-19 booster? Shingles is so painful.
I know, but she's had it since May. So, I would obviously talk to your doctor about this just to make sure that they give the same advice I would, but it's probably safe for you to go ahead and get your COVID booster. I will say this, anybody who's had shingles around the eye really should make sure they see an eye specialist. So I just hope that you have been in communication with someone who can make sure that your eye is fine.
Excellent. And finally, here's a question from Mike. I'm ready to get my Moderna bivalent vaccine. Is that how it's pronounced?
Yeah.
Bivalent. But I've heard a few talk about the risks of it messing with one's white blood cell count. Any truth to that?
So any sort of vaccine actually stimulates your white blood cells to actually produce antibodies. So it's unlikely that getting a booster is going to make any significant difference in your white blood cell count. So please go ahead and get your bivalent vaccine. But as usual, if you have any questions about that, talk to your doctor.
Don't worry, Mike. All right, Dr. Mallika, thank you so much. And as always, Dr. Mallika Marshall gives us her best advice, but you should always consult your physician before making any decisions about your health. But if you have questions for Dr. Mallika, here are the 3 ways to reach her. Email drmallika@cbs.com, on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall.